Hello everybody, this is Dr. Kukreja Kalani and today I'll be speaking about allergies. So allergies in children and infants, especially the skin allergies and the respiratory allergies. So allergies are hypersensitive immune responses to substances that are normally harmless. Children, including infants, newborns, can experience various types of allergies, with skin and respiratory allergies being particularly common. So here's a detailed outline for these types of allergies. First is the skin allergies. So let's talk about contact dermatitis. It's a type of skin inflammation that occurs when the skin comes in direct contact with the irritating substance or allergen. So common triggers are soap, detergents, fragrances, metal, latex, wool, or certain plants like poison ivy. Symptoms are a red, itchy rash, swelling, dry, cracked, or scaly skin. The common areas affected are hands, face, neck, or any area that has been in contact with the allergen. Next, we describe the eczema. The eczema, which is also called as atopic dermatitis, it's a chronic skin condition characterized by dry, itchy, and inflamed skin. Triggers can be genetic factors, any irritants, allergens, heat, dry skin, and stress. Next, we come to hives. So hives are basically the raised red itchy wells that appear suddenly either due to allergens or any change in temperature or stress. Hives are also called as urticaria. The triggers could be food allergies, example the milk, eggs, peanuts, any medication, insect bites, or even physical triggers like temperature, extremes of temperature. Next we come, what are the symptoms of hives? Itchy wells that may vary in size and they usually resolve within hours to few days. Chronic hives last longer. Next we describe the diaper rash. It's a form of contact dermatitis caused by prolonged exposure to moisture, friction, and irritants. Next is the food allergies. So the allergic reaction to certain foods that can result in skin manifestation. The common allergens are milk, eggs, soya, wheat, peanuts, tree nuts, fish, shellfish. The symptoms are rash, eczema, flare-ups, hives, swelling, especially around the face, lips, and eyes. Next, we describe what are the types of respiratory allergies in children and infants. So first we come to the allergic rhinitis, which is also called as hay fever, an allergic response that affects the nasal passages causing inflammation, symptoms similar to common cold. The triggers are pollen, that is a grass, trees, weeds. Next is the dust mites, mold, spores, pet dander, and smoke. Symptoms are sneezing, running or blocked nose, itchy nose and eyes, watery eyes, and postnasal drip. Let's describe asthma, a chronic respiratory condition characterized by inflammation and narrowing of the airways, making breathing difficult. Triggers such as dust mites, pollen, mold, spores, pet dander, smoke, cold air, and respiratory infections. Symptoms include wheezing, shortness of breath, coughing, especially at night or early morning, chest tightness, and rapid breathing. Next, we describe the allergic conjunctivitis. That's the inflammation of the conjunctiva. That is a thin membrane which covers the eyes because of allergen. The common triggers are the same: the pollen, the pet dander, mold, spores, dust mites, or smoke. Symptoms include red, itchy, watery eyes, swelling of the eyelids, and discomfort. We've heard about a very common term called as sinusitis, which is we can describe, the definition is basically an inflammation of the sinuses due to allergic reaction leading to sinus congestion and discomfort. The symptoms are thick nasal discharge, nasal congestion, facial pain or pressure, headaches, and postnasal drip. Chronicity: allergic sinusitis can lead to chronic symptoms and recurrent infection. Now we describe the chronic cough, a persistent cough that is linked to allergies or asthma. The triggers are such as pollen, mold, spores, smoke, or pollution. Symptoms of chronic cough are continuous cough which is worsened by exposure to allergen or physical activity or cold air. Now, what are the common allergy triggers in infant and children? First is the pollen, that's the grass, tree, or weed pollens. exposure primarily a problem during certain seasons such as spring, summer or fall when pollen levels are very high. Next is the dust mite, tiny organism that lived in household dust, thriving in warm, humid environment. Common sources are bedding, carpets and soft toys. Next is pet dander, tiny, even microscopic flakes of skin shed by pets like cats, dogs and other furry animals. The protein in the pet's saliva, skin and urine can also trigger reaction. The symptoms can lead to skin rashes, respiratory issues like allergic rhinitis or asthma. Next we come to a very common trigger, which is the mold spores. The mold grows in the damp areas such as bathrooms, basement or areas with water damage. The impact upon the health, that is exposure to mold, can cause both skin and respiratory allergic reaction. Next is the food. The common allergens are the milk, eggs, peanuts, tree nuts, soya, wheat, fish and shellfish. Environmental irritants such as smoke, tobacco and wood smoke can irritate the respiratory system, aggravating the symptoms of allergies and asthma. Next is pollution, and then the household chemicals such as the cleaning products, air fresheners. Now, what are the risk factors for allergies in children? So, first is the family history. Children with a family history of allergies such as asthma or eczema are more likely to develop an allergic condition. Next is age of exposure. So, infancy, early exposure to potential allergens may affect the likelihood of developing allergies. Next is the environmental factors. Growing up in an environment which is with high exposure to dust, mold or pet dander may increase the allergy risk. Next is the environmental factors. The pollution, the urban living and the higher levels of pollution are associated with increased rates of respiratory allergies. Next is the presence of other allergic conditions such as atopic reaction, which usually starts with eczema followed by food allergies, allergic rhinitis and asthma. Immune system sensitization. Presence of one allergy often indicates a predisposition to develop others. Allergies in children can significantly impact their quality of life. Understanding different type of allergies, common triggers and associated symptoms is crucial for managing these symptoms and reducing the risk of further complication. Now, what is the homeopathic approach towards management of allergies? So, it's very essential to take up a complete case history as regards the genetic inheritance, then the surrounding, the environmental aggravating factors, and also a brief summary of the symptoms, which leads to the choice of remedy. When we prescribe the constitutional medicine in homeopathy for small children, it reduces the tendencies towards the allergy. Thus, we can reduce the secondary bacterial infection and reduce the recurrence of viral infection in small children. So, homeopathy medicines not only raises immunity but also sets right the altered immunity so that the body defense mechanism can itself take care of the problem. So, over a period of time when the medicines are continued, whether it be a skin allergy or cold allergy, the response is very good, and it basically aids the system in learning to how to wear out these genetic tendencies with help of medicines which are very beneficial and with minimum or absolutely no side effects. So it's very essential that whenever the problem gets very chronic, instead of using repeated allopathic medicines, we take care of the whole case with homeopathy. I hope this podcast would help in understanding in detail about allergies related to skin as well as respiratory complaints in children and infants. Signing off, this is Dr. Kukreja Kalani.